Imagine a tiny worm, hidden in your intestines, growing up to 12 inches long. This is the reality for over a billion people around the world. Yes, you are thinking right. We are discussing Ascaris lumbricoides. Let's know more about this parasitic disease. Number 1. What is Ascariasis? Ascariasis is an intestinal infection caused by the parasitic roundworm Ascaris lumbricoides. It is one of the most common helminthic human infections worldwide. Number 2. What is the morphology of Ascaris lumbricoides? Ascaris lumbricoides is a large, cylindrical, cream-colored roundworm. Adult females can grow up to 35 centimeters long, while males are slightly shorter and have a curved tail. The worm has a tapered body at both ends, a thick cuticle, and 3 prominent lips at its anterior end. Its eggs are oval, thick-shelled, and have a rough, mammillated outer layer. Number 3. How do people get infected with Ascaris? People get infected with Ascaris by ingesting its eggs, which are found in soil, water, or food contaminated with human feces. This usually happens in areas with poor sanitation, where human waste is used as fertilizer or hygiene practices are inadequate. Number 4. What are the symptoms of Ascariasis? Symptoms of Ascariasis vary depending on the worm burden. Mild infections may have no symptoms, while heavier infections can cause abdominal pain, nausea, vomiting, diarrhea, and malnutrition. During the larval migration phase, cough, wheezing, and shortness of breath may occur due to lung involvement. Number 5. How is Ascariasis diagnosed? Ascariasis is primarily diagnosed by microscopic examination of stool, where characteristic Ascaris eggs are detected. In some cases, adult worms may be passed in stool or vomit. Imaging techniques like abdominal X-rays, ultrasound, or CT scans can help identify worms in cases of intestinal or biliary obstruction. Number 6. Can Ascariasis cause complications? Yes, Ascariasis can cause serious complications, especially in heavy infections. These include intestinal obstruction, biliary or pancreatic duct blockage, malnutrition, growth retardation in children, and lung inflammation during larval migration. In rare cases, it can lead to peritonitis if the intestinal wall is perforated. Number 7. How is Ascariasis treated? Ascariasis is treated with antiparasitic medications such as albendazole, mebendazole, or ivermectin. These drugs are effective in killing adult worms. In cases of complications like intestinal blockage, surgical intervention may be required. Treatment is usually simple and highly effective with a single dose. Number 8. Is Ascariasis contagious from person to person? No, Ascariasis is not directly contagious. It requires ingestion of eggs from contaminated sources. Number 9. Who is at risk for Ascariasis? Ascariasis primarily affects people living in areas with poor sanitation and hygiene, where contaminated soil or food can lead to infection. Children are particularly at risk due to their frequent hand-to-mouth behavior. Those who live in rural or developing regions, particularly in tropical and subtropical climates, are also more susceptible. Number 10. Can Ascariasis be prevented? Yes, Ascariasis can be prevented by practicing good hygiene, such as regular hand washing, especially before eating and after using the toilet. Consuming properly washed and cooked food, improving sanitation and sewage systems, and regular deworming in endemic areas also help reduce the risk of infection. Number 11. How common is Ascariasis? Ascariasis is one of the most common parasitic infections worldwide, particularly in tropical and subtropical regions. It is estimated that over 1 billion people are infected, with the highest prevalence in areas with poor sanitation and hygiene. Ascariasis is just one of many hidden threats in the world of microbes. Like, share, and subscribe to Tiny Predators for more videos that help you stay informed and healthy.